Hi all, a very good day I would like to bid to each and everyone who are watching this video. My name is Sharmina, daughter of Shanmuga from Bachelor of Pharmacy, Horns, Cohort 6. I am a KPJUC student. Today I'm going to share, discuss and also would like to give you some important relevant information and facts regarding a topic known as breast cancer. Hope this video will be very useful for everyone who are watching. So come, let's go. Breast cancer. Breast cancer is a disease which cells in the breast grow out of the control. There are different kinds of breast cancer. The kind of breast cancer depends on which cells in the breast turns into the cancer. Breast cancer can begin in different parts of the breast. A breast is made up of three main parts, which is lobules, ducts, and also the connective tissue. The lobules are the glands that produce milk, while the ducts are the ones who carry milk to the nipple. The connective tissue, which consists of fibrous and also fatty tissue, will surrounds and holds everything together. Most breast cancer begins in either ducts or the lobules. Breast cancer can also spread outside of the breast through the blood vessels and also lymph vessels. When breast cancer spreads to other parts of the body, it is said to have metastasized. Simple to say, breast cancer is a cancer that forms in the cells of the breast. These are the signs and symptoms of the breast cancer, such as constant breast or nipple pain. Nipple is inverted, turning inward. Rash or color on the skin around the nipple. Change in size or shape of the breast, and many more. Several risk factors that you cannot change that might can get you breast cancer, such as getting older. The risk of breast cancer increases with age. Most breast cancer are diagnosed after age 50. Secondly, genetic mutation. Then, reproductive history. Having dense breasts, personal history of breast cancer or certain non-cancerous breast diseases. Family history of breast or ovarian cancer. Previous treatment using radiation therapy. Women who took the drug diethylstilbestrol, which is known as a DES, or certain medication that can cause or leads to breast cancer. Breast cancer screening means checking a woman's breast for cancer before there are signs or symptoms of the disease. Breast cancer screening test. Number 1. Mammogram. Mammogram is an X-ray of the breast. For many women, mammograms are the best way to find breast cancer early, when it is easier to treat and before it is big enough to feel or cause any symptoms. Having regular mammogram can lower the risk of dying from the breast cancer. At this time, a mammogram is the best way to find the breast cancer for most women of screening age. Next is MRI, breast magnetic resonance imaging. A breast MRI uses magnets and radio waves to take the picture of the breast. Breast MRI is used along with the mammogram to screen women who are at higher risk of getting the breast cancer. Next we can see is clinical breast exam. Clinical breast exam is actually an examination by a doctor or nurse who uses his or her hands to feel for lumps or other changes, or even we can do our breast self-awareness. What is known as staging in the breast cancer? If breast cancer is diagnosed, other tests are done to find out if cancer cells have spread within the breast or to other parts of the body. This process is called as a staging. Whether the cancer is only in the breast, is found in lymph nodes under your arm, or has spread outside the breast determines your stage of the breast cancer, and this is known as the staging. The treatment of the breast cancer, such as surgery, chemotherapy, hormonal therapy, biological therapy, or radiation therapy. Even you can use complementary and also alternative medicines. If you want to know more about it, consult your doctor to know more information regarding it. Who else can get this breast cancer? Not only the women who are 50 years old and older are getting it, but also the young women also getting it. But besides that, even men also are getting breast cancer. Even it is rare, but they are still got chances to get the breast cancer. Let me tell you a small statistic regarding this breast cancer. In 2018, about 2 million women were diagnosed with breast cancer. What's scarier is here that the number of Asian women who will be diagnosed with the breast cancer in the next 30 years will be nearly double that of everyone else, because it is the most common cancer in women in almost every country, even Malaysia is included. Let's look at the current statistic of Malaysian people having cancers with the reference of WHO. According to the current recent statistic with the reference of WHO, in Malaysia in 2020, breast cancer holds about 17.3% from an overall incidence of the cancers. While for the death rate incidence, breast cancer holds a second highest position. There are several ways that we can use to reduce the risk factor of the breast cancer, such as keep a healthy weight and ideal BMI, exercise regularly, do not drink alcohol or limit the alcohol drinking, do not smoke. If you are taking or have been told to take hormonal replacement therapy or oral contraceptive or known as the birth control pills, ask your doctor about the risk and find out if it is right for you or not. Other than that, breastfeed your children if possible. Next, if you're having a family history of breast cancer or inherited changes in your BRCA1 and BRCA2 genes, talk to your doctor about other ways to lower your risk. And don't forget to keep a healthy lifestyle and also eat healthily. Not only breast cancer, but all the cancers are having serious complications and also fatal and dangerous for your life. So staying healthy throughout your life will lower your risk of developing cancer and improve your chances of surviving cancer if it occurs. That's all from me. Thank you so much for listening and hope you got some information and facts regarding this breast cancer. Until then, next time. Bye bye.